now we're going to talk about the arches. We have the superficial palmar arch and the deep palmar arch. So let's try to understand this with a diagram. So on one side, we have the ulnar artery main. It will be giving a small deep branch. Then on the other end, we have the main radial artery. It will come and anastomose with this deep branch at the ulnar artery. And it will also be giving a superficial branch over here like this, and it will anastomose with the main ulnar artery. So here we have the ulnar artery proper. This is the deep branch of ulnar artery. This one is the superficial branch of radial artery, and this is the main radial artery proper. So now this one is the superficial palmar arch, and this would be the deep palmar arch. So once again, the main radial artery will communicate with the deep branch of the ulnar artery, forming the deep palmar arch, and the main ulnar artery cover will communicate with the superficial branch of the radial artery to form the superficial palmar arch. Now, talking about the location of the superficial palmar arch and the deep palmar arch. We have two important structures which define their location. Now, the superficial palmar arch will have above it the palmar aponeurosis, and below the superficial palmar arch will be the flexor tendons, and below that would be the deep palmar arch. So if we go from above downward, we will have the palmar aponeurosis, then we will be having superficial palmar arch, then flexor tendons, and the deep palmar arch. So coming back to the theory, so superficial palmar arch is anterior to the flexor tendons, it is anterior, that is above, and it is deep to the palmar aponeurosis. It is mainly formed by the ulnar artery and also contribution from the radial artery. But the main 80% contribution is from the main ulnar artery, and from the superficial branch of the radial artery is about 20%. Talking about the deep palmar arch, it is deep to the flexor tendons. It is formed mainly, for example, 80% by the main radial artery and small contribution from the ulnar artery as well. So it supply now the superficial palmar arch is going to supply the common and proper digital arteries to all four fingers, whereas the deep palmar arch supplies the metacarpals, wrist joint, and the deep structures of the hand. So now I have summed up the blood supply of the upper limb. I hope this video would be of help. So do subscribe to my channel. Thank you for watching.